Let's dive right into this explainer and unravel a real medical mystery today about non-metastatic prostate cancer and a pretty surprising truth regarding patient regret. When facing a cancer diagnosis, the immediate instinct for so many of us is to just get it out or destroy it as fast as possible. But today, we're going to look at some deeply fascinating data that might just flip your intuition completely upside down. We are focusing exclusively on prostate cancer that has not metastasized, meaning the cancer cells are still entirely confined within the prostate gland.
Based on a highly revealing 2021 study published in a top-tier medical journal, I actually want you to guess which treatment path leads to the highest subjective regret for patients down the line. It's a heavy question, right? When the dust finally settles and the primary medical crisis is handled, which path leaves patients looking back and thinking, man, I really wish I had done things differently? The answers uncovered in this research give us an incredible window into the reality of post-treatment life.
Section 1. Treatment options and risks.
To solve this mystery, we first need to lay out the board and understand the standard choices available for prostate cancer that hasn't metastasized. Basically, there are three main options on the table. You've got surgery to physically remove the prostate. You've got radiation therapy to target and eliminate the cancer cells. And then you have watchful waiting, often called active surveillance, which involves closely monitoring the cancer through regular PSA tests without immediately intervening. Now, keep in mind that hormonal therapy does sometimes pair with radiation, but we're just going to focus on these core three pathways today.
What's really interesting here is that a patient's risk level completely dictates their options and ultimately influences their potential for regret. Not all non-metastatic prostate cancers are exactly the same. They're categorized based on their degree of malignancy and PSA levels. Low risk means the cancer is highly localized and slow-growing. High risk means that while it hasn't spread to other organs yet, the PSA levels are higher, the malignancy is greater, and the cancer is showing signs of local progression.
Section 2. Low risk. The best choice.
Let's look at our first scenario. Patients dealing with a low-risk diagnosis where all three of those treatment options are available. Ask yourself, if you were handed this diagnosis, would you choose to cut the cancer out immediately with surgery, blast it with radiation, or simply monitor it through watchful waiting? Honestly, a lot of people might intuitively think that watchful waiting would cause the most regret. After all, if the cancer suddenly progresses, wouldn't you absolutely kick yourself for not acting sooner?
Well, the 2021 paper reveals a totally counterintuitive truth. For low-risk patients, those who chose aggressive surgery or radiation actually showed a stronger tendency for regret compared to those who just watched and waited. So, the winner for the absolute least amount of regret in the low-risk category is watchful waiting. It turns out that jumping into active treatments when they might not be immediately medically necessary leaves a lot of patients wishing they had just held off.
And here's the crucial point. This study isn't about objective clinical cure rates, it's about the lived, subjective reality of how patients feel about their bodies after the fact. Regret is an entirely subjective experience. It's not a doctor looking at a chart and saying, hey, you're cured. It's the patient waking up every single day and dealing with the physical realities of their choice. When low-risk patients experience the side effects of surgery or radiation, they very often feel the trade-off just wasn't worth it.
Section 3. High risk. A surprising conclusion.
Now we're going to raise the stakes and look at high-risk patients, where simply monitoring the cancer is no longer a medically safe option. Since watchful waiting is completely off the table for these folks, the disease has to be treated actively to prevent it from spreading. So I want you to guess again. Between surgery and radiation, which one leaves high-risk patients with the most regret? Remember, both of these are major interventions with significant impacts on the body. This brilliantly illustrates our second major reveal. The study clearly found that radiation therapy results in significantly less regret than surgery for high-risk patients. Now, it's definitely worth noting a fascinating nuance from the data. High-risk patients who undergo surgery actually regret it slightly less than low-risk patients who undergo surgery, likely because the high-risk patients knew they had to do something drastic. But still, when placed head-to-head, surgery results in a distinctly higher degree of regret than radiation.
Section 4. Understanding the regret.
To really understand why surgery consistently causes more regret across the board, we've got to look at the specific physical toll these treatments take on the human body. By comparing the immediate post-operative struggles of surgery to the late-onset complications of radiation, we start to see exactly why patients feel the way they do. Surgery brings major immediate risks of urinary incontinence and erectile dysfunction. Radiation, on the other hand, can cause late-onset side effects, meaning they show up much later down the line, like hemorrhagic cystitis, which is severe bladder inflammation,
or proctitis, which is inflammation of the rectal lining leading to blood in the urine and stool.
While both treatments can and absolutely do impact erectile function, it's actually the severe urinary incontinence, especially during that grueling first 6 to 12 months post-operation, that heavily drives surgical regret. The immediate loss of basic bodily control right after the operation is incredibly psychologically taxing. And while the severity can sometimes depend on the surgeon's skill, the patient's existing bladder health, and their sphincter muscles, it remains the primary driver of why surgery feels so punishing for patients early on. To be perfectly impartial, though, we have to look at the strategic trade-offs here. Surgery does offer the strategic benefit of leaving radiation as a viable backup plan if the cancer ever happens to come back. Generally speaking, you can do radiation after surgery, but you really cannot easily do surgery after radiation. On the flip side, radiation's main perk is that it's an outpatient procedure. You don't need a lengthy hospital stay, you can get your treatments on an outpatient basis over a series of days, which is a massive lifestyle benefit.
Section 5. The pre-surgery solution. If you or a loved one absolutely must choose surgery, either for medical reasons or just personal peace of mind, there is a highly effective, actionable step you can take to mitigate this exact regret we've been talking about. Doctors strongly emphasize that training your urethral sphincter muscles before the operation drastically changes the severity of post-op complications. We're talking about targeted pelvic floor muscle exercises. And yes, Kegels aren't just for pregnant women. Strengthening the urinary tract beforehand isn't just a mild suggestion, it's practically a requirement if you want to protect your quality of life.
Putting in the hard work with pelvic floor exercises before you even reach the operating table is the guaranteed way to protect your future quality of life. Many top doctors will drill this into their patients, practically begging them to do these exercises. Because the reality is, the state of those muscles before you go under the knife plays a massive role in how quickly you regain continence, and by extension, how much you might end up regretting the surgery during that tough first year.
I'm going to leave you with that thought to ponder, because understanding the realities of patient regret is really the first step toward making truly empowered health choices. It's not just about surviving, it's about how you feel while you are actually living. Knowing that the heaviest medical intervention isn't always the one that leaves you happiest, how will you approach your own medical crossroads in the future? Thank you so much for joining me for this explainer, and I sincerely hope this data helps you or someone you love make the best possible decisions moving forward.